Welcome to the Pod of Inquiry. Ready for some thought-provoking cerebral whipping and the destruction of ridiculous medical dogma? Want to shift those stale, moldy old paradigms? Well then, don that thinking cap of yours. Get down in the cave and join our host, Dr. Stephen Barrett, for this week's episode. Let's start spelunking.
My guest today is Jeanine Souren, who is a clinical psychologist and a sexologist with specialties in couples and family relationships. Jeanine has dedicated her career to helping repair, heal, and strengthen relational brokenness and sexual challenges for couples and individuals. She and her clinic partner, Dr. Hans van Weckum, co-founded the Experiential Training Institute in the Netherlands. Hans was a guest on my show last summer, which was Season 4, Episode 23. If after listening to this great conversation with Jeanine, you want to know more about psilocybin, I recommend you go back and listen to that episode as well. Jeanine discusses how she manages common sexual and relationship difficulties with augmentation using psychedelic agents. Please enjoy this very informative and really interesting conversation I have with Jeanine Souren. Well, good morning, everyone. Welcome to the Pod of Inquiry. I have a very fascinating guest this morning and really excited to have her on. Jeanine Souren from the Experiential Training Institute in the Netherlands. Jeanine, tell us a little bit, not only about yourself, but about what you and Dr. Weckum have organized and formed in the Netherlands.
Thank you for having me on your podcast, Stephen. It's my honor to be here. My name is Jeanine. I'm a psychologist. I'm also a clinical sexologist and a systemic therapist. And myself and Hans van Weckum, who's the physician you mentioned before, have started a training institute where we work with psilocybin, which is a psychedelic component, and we offer retreats. So we train professionals. That's one thing we do. And the other thing we do is that we offer retreat models for people who come from all over the world who want to experience psychedelics in a safe setting and under medical supervision in the Netherlands, where it's legal.
Sure. And so when you started out in when I was talking to you before we started recording, when you go to their website and look at all of her credentials, it's pretty massive. So when you started out, and I want to talk about sexology because you're the first person I've ever known that is a sexologist, and it's very interesting when you start to look into it. So tell me about how did that evolve first, or was it your clinical psychology in, let's call it more of the mainstream before you got into sexology?
Yeah, in the Netherlands, you have to have a degree in psychology first before you can specialize in to become a licensed and accredited sexologist. One of the demands is that you first already have the license of a psychologist. So first I became a psychologist, and then I was really interested in relationships and sex. And that was also because I ran into issues in my own relationship in this area. So that's when I started to specialize in this area. So in the Netherlands, that's a couple of years of extra education and supervision and actual working in this field. And in my private practice, I see a lot of couples who struggle with issues in the bedroom. And so that's most of my work consists of trying to help couples often long-term relationships where there are issues. And the issue that I see most often is difference in desire. And it's very interesting because after I became a sexologist, I wanted to know more about sexual trauma and ways to heal sexual trauma. And that's when I became aware of the potential benefits of psychedelics. So the first thing I started to do was study about the effects of MDMA on sexual relationships and for couples, but that's not yet legal. So then I started working with psilocybin, which is legal under certain conditions in the Netherlands with couples, and that's also very interesting.
Right. Now, did you see a big difference between MDMA and psilocybin as far as the psychedelic effect, the integration of what you're trying to do to help folks, or was there a substantial equivalence between the two?
That's a really good question, Stephen. There is a significant difference. MDMA in such is not so much hallucinogenic. So MDMA is also called a heart opener, and it really kind of suppresses the fear receptors in the brain, which means that you can have really open conversations without the two enemies of feeling sexually free, which is shame and guilt. And when shame and guilt are not on the table, even if it's just for 4 hours, the amount of connectivity you can establish by having meaningful conversations with your partner is incredible. Like psilocybin is much more of an individual component, which you have an individual journey with. So usually you close your eyes and you go inside. And when you are done with the psilocybin journey, which can last between 4 to 6 hours, very many layers are stripped, often of the ego, which means that people really get in touch with what really matters. So like their value system and connections with their loved ones is the number one reported outcome that people have from a psilocybin journey. So it works in a different way. It's not really comparable, MDMA and psilocybin, but both have a big impact on connectivity. And then there's one more thing that's really important, I think, to mention. Psilocybin is known to have something that we call neuroplasticity, which means that you can build new pathways in the brain.
Right.
And MDMA is not known for that. So there's different pros and cons for both substances.
So let me ask you this, because it's very interesting. I mean, I've always heard that that MDMA is classified as an entheogen. It's the empathetic drug. It makes you able to experience or maybe at least appreciate the other's point of view without feeling threatened. I had Dr. Andrew McLean-Pagan on. We haven't aired it, but he refers to all of these agents as entheogens, which I thought was kind of interesting because that's a little bit different than what I've read in I was going to say the mainstream psychedelic space, but I don't know that you can use those two words together, right? Mainstream and psychedelic, because it's not mainstream yet, in my opinion. It should be, but what's your insight on that?
Yeah, I like that word, entheogens. It's not really that much used in the Netherlands, but I really like it because it kind of refers to the godly aspect. And I feel all of these substances or plant medicines, they get you in touch with the God within you. So it doesn't have to do anything with religion or spirituality per se, but you connect with that inner part of you that is non-judgmental. And to feel that, because you can think about it and have cognitive ways of going about it, but to really feel that, there's nothing you can compare that to. No talk therapy can talk about this and be compared with feeling it.
So what you're saying then, I mean, I've not really read that much about MDMA, other than, the entheogenic properties of the agent. But how does it have any lasting effect without having some component of changing the neuroplasticity of the brain?
Yeah, so that's where the biggest work comes in. So the biggest work comes in after a session. Okay. So I feel that's where I come in as a therapist, very much so, because people can have the most amazing free conversations without shame or guilt, or they can have the most amazing insights from a psilocybin journey, but what you do with it afterwards without the help of a substance is really what matters. So for example, for the 4 hours that MDMA, for example, has an effect in the brain, and where you can feel free to have no shame and no guilt, how do you translate that then to the week after, or the week after that, or the week after that? And that takes conscious input and effort, because it's very easy, like when a lotus flower, it opens all the leaves, right? But after a journey, slowly that closes up again, and then how do you open it again without going back to the substance?
Right.
So that really is a process of layer by layer, and keep talking about it, continuing the conversation with your partner if you come for couples therapy, and not let it wait for the next 3 months, which is like the minimum period of time I would advise to leave in between. Right. So we should try to not jump from stone to stone, but we should try to also swim in the water in between.
So I think if I'm hearing you correctly, just the agent alone, without the psychotherapy or however the counseling, that type of integration, it's probably not going to be nearly, or if any, effective nature. That it has to be conjoined.
That's what I think. I mean, there's a lot of people who've done a lot of work and who don't necessarily need the guide of a therapist, but the people that come to my practice, for example, they need the therapeutic assistance. But that's my opinion, is that a therapist can take people deeper and can give pointers to what to do, what not to do, and how to keep the doors open that were open temporarily during a medicine session.
So basically, the MDMA, you get the couple together, they strip down all of these barriers that there somehow is impeding the communication between these two folks. And then after that, then you're able to kind of start with a little cleaner slate, so that you can do the real work.
Right, but people when people plan for, let's say, an MDMA session, I'm not allowed to be there or to help them in any way. So I not in the Netherlands, not yet.
Okay.
So I prepare a couple who's planning to do that. I cannot advise them to do that, but I prepare them of how do you go about it, and how do you bring up for example, relationship injuries or the sexual traumas that are blocking their sexual relationships, which is their presenting issue, right? So there is like a protocoled method to have a couple's MDMA session, and then before and after, I can be there for them to work with them. But the actual medicine session that's not yet legal. Of course, it happens a lot underground, but
yes. Yeah. But are there? I mean, I'm certain there's some places in the world where MDMA is perfectly legal.
I think in the research settings. So if there has been some research on people where one partner has PTSD and the other one doesn't, and they are being monitored by a clinical psychologist, and she does research on what the effects are on their relationship. But that's pretty much all I know that is done in terms of legal MDMA for couples used.
So let me get this right. If it wasn't a legal issue, you could be with them during that experience, right? Or you wouldn't want to be?
I think I would want to be with them, because it's not per se about taking your clothes off and actually doing the deed, because MDMA does have a side effect that it's very difficult to reach an orgasm, for example. But as a therapist, to be there and to help a couple walk through those difficult conversations, I could see the benefits of that, definitely.
So it has to be a very complex process. When people come to you for couples therapy, there's probably, like you mentioned, PTSD. There's other things going on with one or both. And so do you find that to really get everything to the optimal level, that you will maybe integrate a psilocybin session or something to clean up one aspect that may be contributing to the interference between the couple themselves? Is that a common event?
I don't know what you'd call common, because it really depends on the unique issue. But I can say that a shared psilocybin session, so where you have a couple that is journeying together, even though their eyes are closed and they're going inside, but they're in the same room and they can they can see or feel each other. That's a very special energy that goes around. And with that, I am able to be in the room and to work with them throughout the whole thing. And each person who comes out of a shared journey has an individual story, yet the longing and desire for their loved one is really, really big after one comes out of a psilocybin journey. And that is, I think, has very often to do with the spiritual component that often is accompanied by psilocybin journey.
Right.
Much more so than with MDMA per se. And that whole mystical component that often comes with a psilocybin journey makes people realize what matters. And ultimately, Stephen, what really matters are relationships.
Right.
With yourself, with the other.
Right. And there's a lot of compelling evidence that psilocybin will increase your connectivity to the universe or to the supernatural, or however you package that.
And to yourself.
Right.
Because when people go to therapy, it's very challenging for a therapist to not say anything that's not always neutral. So there you have a therapist in the room who says certain things, and then there is the client, and sometimes there's the couple. So there's three voices in a room. But when you go inside with a psilocybin session, for example, you have the conversation with your observing self, which is a term for a non-judgmental part of you. And that is so safe that there's no shame either.
Right.
And there's no guilt either. And to have that conversation with yourself is super profound.
So let's go through how you would maybe work up a couple, because it's one of those things where I think there's this mistaken belief that you just grab a little bag of mushrooms and head off to your room, and that's so far from really what it should be. That so when a couple comes to you, I mean, they're obviously, you mentioned sexual trauma in the past. And interestingly, one of my colleagues, who's a very famous pain management specialist, has said that in his chronic pain patients, primarily females, there's a super high incidence of sexual trauma, sexual abuse when the individual was a small child or something like that. So let's go back a little bit. So the couple says, okay, Jeanine, we need to come and see you and put our relationship back together. Obviously, you're going to want to try to see if there's any physical, medical problems to begin with. And then, so tell us how you kind of work a couple up to go through this type of therapy, because I think people will be very interested in that.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor.
I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called Stem Regen, which I take daily and genuinely believe could revolutionize your health journey as well. Stem Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. Stem Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once unleashed into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating Stem Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that Stem Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first of its kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co/Dr. Steven, that's with a PH, and use the code SBPOD to get a 15% discount off your first order of Stem Regen.
Yeah, I'll give you an example of a couple. And this is true. This is a real example from my private practice. Yeah. So a couple calls me and says, we have a problem. And the woman said, both of them are 60 plus. Mm-hmm. And they come from a somewhat religious part of the Netherlands. So they come to my practice, I do an intake, and basically the lady says, here's the problem, and she points to her husband. This happens very often, by the way, that a couple comes and one person points to the other and says, there's the problem and I'm coming too. But in this case, the man, and they'd been married for 25 years plus, have 2 children, both of them had been married before, and the man had a let's call it a sex addiction. So he was seeing other women on the side, many of them a lot of times, like on a weekly basis. And then she found out only after 25 years by something that she saw on the iPad. And then it all came out, and he didn't want to lose the marriage. So I decided, okay, there's a lot of work to be done here because the trust is broken. Mm-hmm. And so I started him with a personal psychology trajectory in finding out why he developed this addiction and what age. But he did stop immediately. Like as soon as it came out, he stopped immediately. But so we had to unpeel his youth and what happened in his attachment wounds, etc. At the same time, parallel, I had her do EMDR. I don't know if you're know. That's like a trauma treatment with eye movement.
Yes.
For the most traumatic moment that she couldn't sleep anymore. Of finding out what had happened, but so she also had individual therapy, but then after 6 months, both of them having had their own therapy, they came. I was doing an evaluation with them, and they said we're still not. We're not there. And the woman said, I can't forget what happened, and only then did I talk to them about psychedelic-assisted couples therapy, and they were like, no, we've never done anything. We were not into drugs. And so I gave them a lot of psychoeducation. I didn't advise it to them, and I had them watch some TV shows and some podcasts, and then they came back 4 weeks later and they said, we're ready. Now, keep in mind, this couple is 60 plus, has never even smoked a joint, like a marijuana, not done anything, quite from the church. And they basically gave me the trust. So I had them, prepared them for a psilocybin journey. And what I did was I used stacking doll constellation to make an internal family constellation, where we saw how both of them related to each part of themselves. And that already was really interesting before the journey, because when they went in, they, of course, had their own individual experience, but the woman, and I don't know, so if people are not watching your show, I'm going to show you what she did. And she kept doing this, which means she was basically rubbing with one finger in between, like her other hand's 2 fingers. And she kept rubbing and rubbing. And she did this for like 20 minutes. And I thought, what is she doing? And then she took her husband's hand, and he needed to put his finger on her hand and rub it and rub it and rub it. And then when she came out of the journey, I said, what were you doing? And she said that my heart was broken, and it had big tears in my heart, and I needed to glue it back together, and it needed to be my husband's glue. And so by doing this for like 20 minutes, she glued in her mind her heart back together. And then she said, and then I could open the door for him so he could enter my heart again. So after that session, the relationship went to another level. And that really was able to peel off layers that didn't happen, not with EMDR, not with talk therapy, not with couples therapy. So for this couple, it was very beneficial.
And then you were able to, after that experience, then integrate those.
Yes.
Right.
We had like 10 integration sessions, because it's not a magic wand that it goes away. And also the mystical aspects needed to be integrated. And because they never told me this, but they had an abortion very early on in their relationship. And they never said anything about this in the intake, but that came by in the psychedelic journey of both of them. So they were really tearful when they came out, because they were so ashamed of having had that abortion. And that was another really connecting shared experience that they both had in their individual journey, which was also very interesting. And can I give you another example of another couple?
Absolutely. Yeah. No, this is fascinating.
So there's another couple also of 60 plus that came to me with a similar relationship injury, which was where the husband was cheating on his wife for a long time. And she then wanted to forgive him, but she could only forgive him with her head. But her vagina was closed, like the door was closed. And mind you, she'd given birth. There was no history of vaginismus. It came after that she found out that he was in an affair. And so they came to me and they said, well, okay, we want to continue our relationship together. I'm not seeing this other woman anymore, but we can't have the sex we would like to have, because it's not working and the door is closed.
Right.
And then I had them, I prepared them for a psilocybin session with the same method that I just talked about, which is that constellation with the stacking dolls. And then she took the biggest doll, the biggest stacking doll, and she said, "This is my protector. And my protector is in front of my vagina. So there's no one who can get by." And then we talked about, before the psilocybin session, well, can you talk to your protector and see what is needed to temporarily move aside. And so in her journey, she did have a conversation with her protector. And when she came out, they were able to have a really honest conversation about the conditions that she was unable to voice beforehand, asking her husband to commit to certain promises. And only then was she able to let the protector go aside. And about 4 weeks after the session, they were able to resume their sexual relationships, including penetration.
Very interesting. So the psychological manifestation actually caused a true physiological response in that case.
It's called a psychosomatic trauma response.
Okay.
So it's like, I don't know if you've seen people with restless legs. You must have, right?
Oh, all the time. All the time. Yeah.
So in the journeys, and when I see people do that, I ask them, where do your legs want to take you? What are you walking away from? Or are you walking away from something? I'm not presuming, but Yeah,
Right.
and that's also very interesting that there's not a lot of body language that I ask people's permission to film it with their own phone. And we talk about it in integration when they see themselves talking with their body, and we look at the video and they hear the music again because it's recorded on their phone. And then it's very easy for them to revisit, oh, that was this landscape and I was going through that. And I was expressing this. So that's a part of the integration.
So that's one thing that I think is grossly misunderstood even in the mainstream medical world, is that these are not magic pills. They're not like you just
No.
you just take one and you're done. It's still there's still a lot of hard work that has to be done, and that it needs to be done in the proper context, the set intention, and then following it up with the integration afterwards. But is it so? This couple, the first couple that you talked about, I think that's very interesting. There's a lot of stuff, I guess, that's really suppressed in our subconscious, and that the psilocybin, I guess, not only changing the default mode networks of the brain, but also just letting this stuff out that's been kind of harnessed so tightly that the person may not even recognize that it's been there. And now you're letting the genie out of the bottle a little bit. So am I getting this totally wrong? But that seems to me that it would kind of clean the slate a little bit for what you want to do with them as a couple.
I got distracted, Stephen, because there's something happened in my background.
Okay.
So can you ask me again?
Yeah. So the psilocybin allows a lot of very repressed things, memories that you are not cognizant of, even though I call it the subconscious or the whatever you want to call it. But by allowing that to kind of open up, that seems to, in addition to the default mode network changing after the psilocybin itself, but just basically opening up these things that are maybe repressed and never remembered or acknowledged, but they're there, they're functioning in the background, dragging this particular individual down, that keeps them from maybe really getting the optimum benefit of just psychotherapy alone. So is that kind of what you think is going on? I know the MDA is more of an entheogenic, drops some barriers, but there's also barriers, are there not, with the subconscious not being able to, kind of let it out a little bit?
Yeah, I hear what you say, but I'm really cautious, because sometimes people come back or they land again after a journey, and then they said, "Oh, I know it. I've been sexually abused by my grandfather because I saw it in my journey."
Oh,
and then I am really, really cautious, because sometimes our brain produces symbolic visuals of that, and your brain or your system wants you to understand something, but it doesn't necessarily translate one-on-one with what you have seen. So it doesn't mean that it's true in the real world or not true what happened. But as a psychologist, I always ask, okay, what is the meaning, or what could be the meaning of the representation that has shocked you, or that you saw? Because in my own personal journey, I had a deep conversation with one of my friends who's been dead for a long time, and I thought, what does that mean? What did I go to heaven and speak to someone who's already dead, or where did I go that I met this person? Because it was felt like a real conversation. And then later I peeled it off and I thought, well, what was the conversation about, and what was it showing me? And then I recognized this person that had passed away is a dear friend of mine who had certain character traits that I laughed about when she was still alive, because I thought they were funny, but I was a bit critical of that too. And then I realized I have those too. I am behaving in the same way as she did then, and I laughed about it, but hey, look in the mirror because I'm doing the same thing.
Mm-hmm.
And because it was a nice person that I had the conversation with, because she was my friend, I was able to understand it, not feel criticized, and change it.
Mm-hmm.
To not have that behavior that I didn't really like so much, but because my brain cooked up a scene where I got the message in a kind of a kind way, without it being true per se, because I don't believe I went to heaven. It was really beneficial.
So I'm trying to get my head, no pun intended, wrapped around that a little bit. So what you're saying is that you may go through a psychedelic journey with psilocybin and have things come out of your subconscious that are not even true?
Potentially, because sometimes we don't know.
Right.
But I'm really, really careful in going on a detective mode. Was that true or not? Because a psilocybin experience is super rich in chapters, and sometimes I think it's more about the symbolic value of the message versus did this and this happen at then and then at that and that moment with that person.
Yeah, that's very interesting. I think the brain is one of the last frontiers of human physiology. I mean, really, if you think about it, what is the mind? Where is the mind? Is it in the brain? Is it in the heart?
Yeah.
You know?
That's so interesting. Last week I had someone journey who said, I went into the universe, but then my brain was also the universe. So it doesn't really matter. Is it inside of your head? Is it outside of your head? Because there's so many options, so many opportunities.
Right.
It's fascinating. We don't know.
No, it's very fascinating. So what's maybe the most common thing besides the difference in desire that people would seek out a sexologist for?
Sexual trauma.
Okay. We talked about that a little bit.
Yeah. And then there is sexual dysfunctions, like, for example, erectile difficulties or inability to orgasm. Then there's also body image and self-esteem issues. And like I said, relationship issues. So where couples are struggling to tune into the same frequency.
Right. Now, what about gender dysphoria? It seems like that's becoming more and more of a problem than it ever was. What's your take on that?
Yeah, well, to tell you the truth, I have a lot of colleagues who know a lot more about that than I do. That is one area that I am not that I'm not working with.
Okay.
I am really grateful that I can choose what areas of sexology that I work in, and that's one area that I don't.
So even though you don't work in that area, I want to ask you a question anyhow.
Yes.
Is gender dysphoria more prevalent in females or males? Do you have any idea?
I think, no, I don't have, I would have to look up the numbers, the statistics. What do you think? What's your take on it?
Oh, I have no idea. I mean, I just don't know, but it seems that 10 years ago, we never even discussed or even heard of this. And now it's much more prevalent in conversation and whatnot.
I also think that the numbers are probably not really showing us a realistic image, because in the more developed countries, there's a lot more going on about this. But then in other countries, it's not so much a topic because people have other priorities. Or that is, I think it's a very modern thing that is indeed happening over the last couple of years. I do like the fact, though, that people are able to express themselves in any way they want without the discrimination being so prevalent. I am very happy about that. That is a growing trend, that everybody is allowed to be who they are or who they feel they are, regardless of how they identify.
Right. Yeah. When I was doing the research for coming on with you, I did a little bit of a research search, and it appears that adolescents have, at least from this one source, 0.7 to 2.7%, and adults are like 0.1% to 0.6%. So it appears that this is more of a problem in the adolescent population than it is in the adult population. And my wonder is this, is that, I mean, when you're a kid, there's a lot of confusing stuff going on, and your brain's not even fully formed until you're like 26, 27, depending on what source you're looking at. So in the old days, the pediatricians would say, if somebody came in with a flat foot deformity, don't worry about it because they'll just grow out of it. And the answer was, no, they don't. But it appears from looking at these statistics that may not be the case. Because that's at least a significant degree of magnitude higher than, going from adolescent to the adult population.
Yeah. Yeah. I think there's still a lot more research that needs to be done, because there's also now people regretting, like a sex change operation too, that you hear a lot more about. And there's so many complications. And on the other hand, it is really incredible what modern medicine or modern or the doctors are able to facilitate. But yeah, I think that's an area that I should really dive deeper into when I'm ready. And I'm not.
Yeah.
My hands are full with other problems, like couples problems.
Yeah. Well, I think that, the problem is that when you're a kid, you have no idea what the hell is really going on. And so when you make a decision like that, it may not be a very informed decision. And then 15 years later, you're going, well, what did I do? And then the other thing is that no matter how sophisticated the surgical world is in what they call, I forget, gender affirming surgery or whatever the terminology it is that, well, that person is likely never to be able to conceive and have children. And there's a very high likelihood that they're going to be anorgasmic. They're never going to enjoy the sexual component of human physiology. And those are pretty big hurdles for somebody to really consider when they're 12 or 14 years of age.
I agree.
Yeah.
Yep.
Jeanine, fascinating stuff. Can you tell everybody not only how to get a hold of you guys, but a little bit about your institute? Because it's quite fantastic.
Thank you. We're based in Amsterdam, and we host about a 3-day retreat every month. And we are also seeing an increase in demand of special interest groups. So, for example, now we have a group from New Zealand coming, and they are sharing a similar job that they know each other from, spread out over different countries. And we're also seeing, this is also really fascinating, innovative corporations that want their leadership to be really, really authentic, to peel off all the layers, and then they come in as a management team. So that's what we do too, like special interest groups. We also do systemic work. That means we work with families. And what we do is we have a lot of psychotherapeutic interventions before and after a journey, because we believe, like in the Netherlands, you can do a truffles containing psilocybin journey almost at every street corner. People don't necessarily have to be educated or trauma informed, which I'm not a big fan of. But the model we use is that we do a really thorough screening process, because not everybody is eligible. And then we have online preparation calls for those of you guys who come from abroad. And then people fly in, or they come by train or wherever they live, and then they are being submerged into a 3-day immersive program. And after that, we have another follow-up call, and if people need further integration, they have the option of booking individual sessions. And so all of this is like a package, and I mean, the name of the company is called Experiential, so not experimental, but Experiential Training Institute in the Netherlands.
Yeah, and I think the important thing, and you pointed this out at the beginning of our conversation, is that you're not only taking care of people with the problems, but you're training people to help people with the problems. So that's anytime you have that type of environment, that always infers another level of expertise, because if you're good enough to train other people to do it, then that indicates that you're very good. So,
well, thank you. You know, we are the first institute in the Netherlands that got accredited by some professional boards of therapists. So in the Netherlands, people have to be a member of a professional board to be a certain type of therapist, and they are now warming up. So they gave us education points. So when the Dutch therapists come to train with us, they are rewarded with points, which is amazing.
So like continuing medical education?
Yeah.
Gotcha. All right. Okay.
Yeah.
Fantastic. Jeanine, thanks so much for taking the time. I know you're busy, and there's a lot of people out there that need your help. So I'll put the link. I'll put the link in the show notes so that they can get to you. So appreciate it.
Wonderful.
All right.
Thank you so much, Stephen,
You're
for
welcome.
having me.
Thank you.
And now a message from our sponsor. Well, folks, if you're over 40 and you're not using a supplement to augment nitric oxide production, you should really rethink that. This molecule is absolutely imperative to health, not to mention the cardioprotection. Nitric oxide is a physiological molecule that does so many things for your health. I never miss a day of nitric oxide supplementation. That's how important it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, just go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pod of Inquiry. Use Pod of Inquiry at checkout after registration, and I am certain you will be pleased not only for yourself, but for all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see that nearly every one of them will be deficient. When they see this result, they will want you to start them on it immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates. Thanks for watching. You can start today. I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.